Hi, my name is Jeleni Gomez, and I'm gonna be reading the chapter 24. I'm gonna read it in English, then I'm gonna be translating and the exercises just in English, okay? Like always. And I'm gonna be reading from the book because it's more easy for me, but you can see what I'm gonna be reading in my screen. So let's start. 24. Infections. A. Fever. A medical student has nasal language notes on a case report. Case 45. A 24 years old man presented with a fever which he had for 3 days. On the third day, he had a severe attack of the fever with sweating and rigors. The only past history of relevance was hepatitis 4 years early and glandular fever, infection with instant virus. At the age of 80 years, he had returned from Africa 2 weeks previously. Okay, we're gonna be reading the meanings now. Fever is pyrexia, as I remember, Pios pyrexia of unknown origin. Fever, also known as temperature, I will go at temperature. Adjectives are feverish, febrile, and pyrexial, and the opposites are afebrile and apyrexial. And some symptoms of fever we got sweating or rigors that are severe shivering and sensation of coldness, also known as chills. B. Microorganisms. Infections differ from other diseases in a number of aspects. The first one is, most importantly, they are caused by living microorganisms, such as viruses or bacteria. They can usually be identified to stabilization at the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many non-infections, degenerative and chronic diseases. 2. Communicability is another factor which differentiates infections from non-infectious. Diseases transmissions of pathogenic organisms to other people, directly or indirectly, may be lead to an outbreak or epidemic. And finally, many infections are preventable by hygienic measures, by vaccines, especially life-attenuated vaccines such as rubella vaccine, or by drug prophylaxis, for example, chloroquine to prevent malaria. Okay, microorganisms include bacteria, viruses, fungi, protozoa, such as the parasites that cause malaria. Another general word for these pathogens is microbes. Patients often refers to microbes as germs or bugs. Notice the common expressions for acquiring an infectious disease. For example, a people can say, "Could he have caught some disease from the dog?" Or "Could he have picked up some disease from the dog?" And if I say myself, it will be, "I think I've caught the flu bug that's going round." And C. Source and spread of infections. Here's an extract. Here is an extract from a medical textbooks. Okay, infections may originate from the patient's endogenous, usually from skin, nasopharynx, or bowel, or from outside sources like exogenous. Often other person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in the throat, for example, diphtheria, bowel, salmonella, or blood, hepatitis B, or HIV. Non-human sources of infections include water, example cholera, milk, example tuberculosis, food, botulism, animals, rabies, birds, cytocosis, and also the soil, that is Legionella, Legionnaires disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Now it's time to translate it. Okay. 24. Infecciones. A. Fiebre. Un estudiante de medicina ha tomado algunas notas en un informe de caso. Ok, un hombre de 24 años presentó fiebre que había tenido durante 3 días. Al tercer día tuvo un ataque severo de fiebre con sudoración y escalofríos. Los únicos antecedentes relevantes fueron hepatitis 4 años atrás y mononucleosis infecciosa, infección por el virus de Epstein-Barr, a la edad de 18 años. Había regresado de África 3 semanas antes. La fiebre es igual a pirexia. También está el PUO, que es pirexia de origen desconocido, fiebre también conocida como temperatura, que el paciente puede decir tengo temperatura. Tenemos adjetivos que son eh, febril y pirexia, y opuestos que serían afebril o apirexial. Y algunos síntomas de fiebre son la sudoración y los escalofríos, que son escalofríos intensos y sensación de frío, también conocidos como escalofríos. B. Microorganismos. Las infecciones difieren de otras enfermedades en varios aspectos. Lo más importante es que son causadas por microorganismos vivos como virus o bacterias que generalmente se pueden identificar estableciendo así la etiología y las primeras etapas de la enfermedad. Muchos de estos organismos, incluidos todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades degenerativas y crónicas no infecciosas. La transmisión es otro factor de diferencia que diferencia las infecciones de las enfermedades no infecciosas. La transmisión de organismos patógenos a otras personas o directa o indirectamente eh, puede provocar un brote o una epidemia. Finalmente, muchas infecciones se pueden prevenir mediante medidas higiénicas, dígase vacunas, especialmente vacunas vivas atenuadas como la vacuna contra la rubeola o profilaxis farmacológica, por ejemplo, cloroquina para prevenir la malaria. Los microorganismos incluyen bacterias vivas, hongos y protozoos, como el parásito que causa la malaria. Otra palabra general para esos patógenos es microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o bichos. Observe las expresiones para contraer una enfermedad infecciosa. ¿Podría haber contraído alguna enfermedad del perro o podría haber agarrado alguna enfermedad del perro? Y creo que me he contagiado de la gripe que anda por ahí. Y C. Origen y propagación de la infección. Aquí hay un extracto de un libro de texto de medicina. La infección puede originarse en el paciente endógena, generalmente de la piel, la nasofaringe o el intestino, o de fuentes externas exógenas, a menudo otra persona que puede estar sufriendo una infección o ser portadora de un microorganismo patógeno. Los portadores suelen estar sanos y pueden albergar el organismo en la garganta, por ejemplo, difteria, en el intestino sería salmonela o la sangre, hepatitis B o VIH. Las fuentes de infección no humanas incluyen el agua, por ejemplo, el cólera, la leche, tuberculosis, los alimentos, el botulismo y los animales contienen rabia y las aves, la psittacosis y también el suelo, que sería legionela, enfermedad del legionario. Y el periodo de incubación, el periodo entre la invasión de los tejidos por patógenos y la aparición de las características clínicas de la infección. El periodo de inefectividad es el tiempo en el que el paciente es infeccioso para los demás. Okay, so it's time to read the exercises. Okay, 24.1. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1. 1988 saw the UK launch of Live Attenuate, and it is the J that is measles, mumps, and rubella. The 2 is chickenpox. Varicella is a common infectious. It is the A that is disease of childhood. 3. It is rabies has an incubation. Is A. Period ranging from 4 days to many months. Uh, 4. The patients remain febrile. It is H. That is weak peaks of temperature of 39.5 Celsius. 5. He was admitted with a 4-day history of influenza type. Symptoms of fever, is the B. Rigors, myalgia, and general malaise. Okay, 6. Quite a proportion of patients who recover from hepatitis B. It is the C. Become carriers of the virus. Um, 7. The central part of Africa is in the midst of an epidemic. It is F, that is of AIDS. 8. Measles rubiola is most infectious during the catarrhal stage. And 9. Lyme disease is caused by transmission, J, or B, for the furry from an animal to man by isotidiots. Sorry. And the 10 is PO stands for I, that it is pyrexia of no origin. Okay, now it's time to read this. 24.2. Complete the case report of on the patients in A positive. Look at A, B, and C positive to help you. Case 45. One examination he looked up on well his pulse rate was 100 per minute. He has a palpable spleen, the combination of fever and rigors in a patient who has recently returned from Africa. Strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. And the last one, it is 24.3. Complete the sentences, look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is a fever. And 5. The common infection with Epstein-Barr virus is known as glandular fever. So that was all for this chapter. See you in the next chapter. Bye.